Welcome to your lecture on nursing care plans. The objectives are to understand what a nursing care plan is and to devise a nursing care plan based on an individual patient. So what is a nursing care plan? A nursing care plan is where you plan your care using the nursing process. And the steps involved are assessment, diagnosing, outcome identification and planning, implementation, and evaluation. So let's talk a little bit about each of these. So let's first go into how a nursing diagnosis is worded. So it can either be described as a nursing problem or come from a standardized list of named problems. So the named problems would come from a place called NANDA, N-A-N-D-A, and any nursing diagnosis book can help you to find any standardized names or titles. So there is one in the Upstate Library that is accessible electronically. So an example of this would be ineffective tissue perfusion, powerlessness, infection, pain, acute or chronic. So the format for the entire nursing diagnosis is as follows. You have the nursing diagnosis related to RT, the cause, so what is causing it, the AEB as evidenced by the signs and symptoms that the patient shows. You cannot use a medical diagnosis in the spot that says cause. So for example, instead of saying COPD as the cause, you would say chronic lung disease. So here's an example. Ineffective breathing pattern related to chronic lung disease as evidenced by the patient exhibits a respiratory rate of 25 with labored breathing and a pulse ox of 88%. Okay, so let's look at some outcomes. What would be some outcomes of care? So the outcome must be directly related to the nursing diagnosis. It must be realistic, patient-focused, it must be measurable, and must include a time frame. So an example would be the patient will have a respiratory rate between 12 and 20 with a pulse ox of 90% without labored breathing during my shift. When we're talking about a person with COPD, 90% is actually a really good oxygen saturation. So our goal would probably not be 95% for that patient. Okay, implementation. When we talk about this, we are talking about the nursing interventions. What specifically can and will the nurse do to reach those outcomes or goals? So it can be in one of three categories: assessment, therapeutic, and educational. So an example would be the nurse will assess and record the respiratory rate and depth at least every 4 hours. And in parentheses, I have a rationale. It is important to take action when there is an alteration in the pattern of breathing to detect early signs of respiratory compromise. Another implementation that the nurse would do, the first one was an assessment, the second one is therapeutic. The nurse will place the patient with proper body alignment for maximum breathing pattern. And rationale is a sitting position permits maximum lung excursion and chest expansion. Third one is an educational implementation. The nurse will educate the patient about pursed lip breathing. These measures allow the patient to participate in improved ventilation. So it's important to know the rationale because that will actually help you to learn why you are going to use that intervention. Okay, so now let's talk about evaluation. Evaluation is assessing what is the patient's status after the interventions. Were the goals met? So you can say either goal met, goal not met, or goal ongoing. Just because the goal was not met by the end of your shift does not mean it's a bad thing. Okay? It's okay to say goal ongoing or goal not met because then you would go back in and change the care plan to reflect that. So if the goal is met, add as evidenced by on the end and describe how it was met. So an example would be goal met. Patient has a respiratory rate of 18, oxygen saturation of 90%, and non-labored breathing. Also, you would mention any medications that helped you to reach your goal. So for a COPD, they might use Spiriva HandiHaler, and always put how it was prescribed, 18 micrograms per capsule, 2 puffs 1 time each day. Any labs related to the outcome would be your ABG results, and you would list what those results were specifically. Okay, prioritization. So we must always prioritize the nursing diagnosis. The first priority is always ABCs in that order: airway, breathing, circulation. So in a minute, we're actually going to go over the concept map, and I'll show you what this looks like. So we're going to first prioritize any nursing diagnoses that deal with airway, then those that deal with breathing, then those that deal with circulation. Pain will follow any ABCs, but if there are no ABCs, then pain is first. Risk fors are usually last. So this would be risk for infection, risk for hemorrhage, although that could be important. Risk for ineffective breathing patterns. So the risk for is something that they do not have, but because they're a COPDer, they are at risk for ineffective breathing pattern, but they currently are not showing that. So obviously you would not, in that nursing diagnosis, you would simply have risk for ineffective breathing pattern related to chronic lung disease. You would not have an AEB on the end because there were no signs and symptoms. It was simply a risk for. Okay, so now it's time to try it on your own, and I'm going to go over what the format looks like that we are using in clinical. Okay, so here we have the end of the database. This is your concept map. So as you can see, we have the patient information here in the middle. So their medical diagnoses are intracranial hypertension, COPD, and diabetes. Three very potentially very serious diagnoses. They have their allergies listed as well, their height and weight, and their age. So the numbers that we see here, those reflect the nursing diagnoses, prioritization. Okay? So the very first top priority is ineffective airway clearance. Okay, that is one of the ABCs. That is an airway problem. So that's going to be first priority. Second priority is impaired gas exchange. That would be a circulation diagnosis. So that is why it is second. Thirdly, we have ineffective cerebral tissue perfusion. That's another circulation issue. So how do we know which one is more important? The impaired gas exchange or the ineffective tissue perfusion, cerebral tissue perfusion? So I would say that the impaired gas exchange is number one because that's the first thing that can affect everything else. Okay? So if your gas exchange within your alveoli is being affected, you're not ever even going to get to the ineffective cerebral tissue perfusion. The fourth priority would be risk for infection. See, we have a risk for here. And this relates to the diabetes. So risk for infection related to chronic disease, inadequate primary defenses, and pharmaceutical agents. We have any equipment's risk and precautions. They use a cane. They need one person to assist them to get up. And what should we teach the family and the patient about nutrition and medication safety? So let's break this down. Here's the part of the nursing diagnosis, the concept map, where you're going to break out each nursing diagnosis. So you have ineffective airway clearance related to COPD, which I don't agree with putting COPD in there, but some others might agree with that. I would put chronic lung disease, as evidenced by ineffective cough, adventitious breath sounds, and changes in respiratory rhythm. So the overall outcome, patient will demonstrate effective coughing as evidenced by improved breath sounds, respiratory rate of 95% or better, and improved oxygen saturation by the end of the shift. And see, it does give a date. So sometimes you will put a date as well. So what did you actually assess? So the first column, what did you see? So you assessed an ineffective cough. What are you going to do to address that under interventions? You're going to help the client perform controlled coughing. And that is a therapeutic intervention. Rationale is it increased sputum clearance and makes the cough more forceful and effective. Was the goal met here? Met as evidenced by the patient demonstrated turning, coughing, and deep breathing. So the second assessment was adventitious breath sounds. So we heard crackles. Intervention was to encourage a client to use an incentive spirometer. This could also, it says therapeutic, this could also be educational, because you're going to teach them how to use it. And the rationale is it prevents retention of bronchial secretions. And the goal is met as evidenced by the patient used the incentive spirometer. Okay, and you see any meds related to the outcome, albuterol, dexamethasone, you should really put what the dosing was. Any labs, you see ABGs here. Was the overall outcome met? Yes. Why? At the bottom, patient demonstrated effective coughing by improving O2 sat, improving breath sounds, and improving the respiratory rate. So then, what would you do differently? Nothing, or you could describe what you would have done differently, how you would change the plan. And you would do the same thing for each of the subsequent nursing diagnoses. So all of these will be posted for you, and you see we do have some references in APA format at the end. So these will be posted for you on Blackboard to help you get through your nursing care plan. And if you have any questions, certainly ask your clinical instructor, and we will go over it again in lecture.